The American Health Security and Choice Act, or ACA 2.0, this is my new health insurance proposal. Like ACA 2.0 keeps the core protections, this preserves the core protections of ACA. Pre-existing condition protections, coverage for young adults up to age 26, no lifetime or annual caps on essential benefits, guaranteed issue and community rating, preventative care with no cost sharing, structural changes introduced, subsidy redesign, simplified subsidy formula, expanded eligibility for middle-income households, premiums capped as a percentage of income, more plan types allowed, catastrophic, high deductible, value-based, fewer federal mandates on plan design, increased insurer competition, state-level authority, states gain more control over benefit design, innovation waivers become easier to use, markets can be tailored to local needs, regulatory streamlining, reduced reporting requirements, lower administrative overhead, consolidated federal rules. Intended outcomes, ACA 2.0 aims to improve affordability and choice through structural reform, lower premiums, lower deductibles, more plan options, simpler enrollment, more predictable costs, philosophical shift, a neutral framing of the policy direction. ACA emphasized federal standardization. ACA 2.0 emphasizes state customization and market-based cost control. Consumer protections remain, but the delivery mechanism changes. One sentence summary. ACA 2.0 keeps the most widely supported ACA protections while restructuring subsidies, expanding plan choices, and shifting authority to states to reduce costs and increase flexibility. Cost comparison. ACA versus ACA 2.0, the American Choice Health Security and Choice Act. The original Affordable Care Act cost roughly $35 billion per year in federal spending for premium tax credits and related supports. Under the structure of ACA 2.0, the estimated annual cost would fall to about $15 billion, with a maximum of $25 billion per year. Here's why. Affordable Care Act 2.0 costs less because a hard $200,000 a year income cap with a soft phase out. The ACA subsidizes some higher income thresholds. ACA 2.0 stops subsidies at $200,000 a year, saving an estimated $8 to $12 billion per year. Employer mandate reform. Raising the threshold from 50 to 100 employees reduces the number of workers pushed into subsidized marketplace plans. Estimated savings $3 to $5 billion per year. Expanded catastrophic plans, allowing all adults to buy catastrophic plans, lowers premiums and reduces subsidy amounts. Estimated savings $2 to $4 billion per year. State flexibility. States can redesign subsidy structures and benefit packages within guardrails, which historically lowers federal spending. Estimated savings $1 to $3 billion per year. What ACA 2.0 adds and why it still costs less overall. Federal reinsurance. Reinsurance stabilizes premiums but costs money. Estimated cost $6 to $10 billion per year. Health insurance HIPAA accounts. That's the health insurance account. Restricted use accounts require IRS HHS systems. Estimated cost $1 to $2 billion per year. Automatic re-enrollment. More people get insured, which increases subsidy spending. Costs $3 to $6 billion per year. Bottom line, the savings outweigh the new costs. Original ACA $35 billion per year. Affordable Care Act 2.0 $15 billion to $25 billion per year. ACA is cheaper, more flexible, and more stable, while still protecting coverage and consumer choice. $200,000 a year income cap, it would not affect anyone in New Hampshire. Everyone who benefits under the Affordable Care Act now in New Hampshire makes $200,000 a year or less.